We need to talk about admin. A colleague has been looking after her mum with advanced dementia for some years now. And when recently we talked about our respective stress levels, she told me a story that got me thinking. She needed to buy petrol, and the petrol station was busy, and the pump she got onto didn't work, and so she had to queue again. And then someone didn't move their car when they went in to pay, and all in all, it was just one of those really annoying experiences. And she said she could barely stop herself screaming. Do you know my mum is really sick, and I am sick with worry, and can you just get on with it and get out of my way? Do you know how hard this is? She's a grown-up, and of course she knows that those poor people at the petrol station, incompetent or inconsiderate though they might be, don't know how stressed she is and why. My experience of much NHS admin is a bit like this. Only it isn't, because the people and processes I'm dealing with know what's up in my life, because that is why I'm there. They know how stressed I am, how stressed all of us are in this waiting area, in this telephone queue, in this booking system. The admin malaise in the health and care system is well known and understood even by its most sporadic users. It's clunky at best, unsafe at worst. So when I pointed out to the clinical director for the cancer services at the world-class hospital where my husband David was being treated, how useless much of their admin was, he basically said he knew all of that and apologized for the inconvenience this must have caused us. The point is, this particular garage forecourt doesn't cause inconvenience. It causes upset and a loss of trust and anxiety. Because if a hospital knows how hard their users' lives are right now, and they still don't make their letters arrive on time or respond to phone calls or check that all the results are in before an appointment is booked, it doesn't inconvenience patients and carers. It messes up our care. It tells you, we know that you're in pain and distress, but this is not important enough for us to get ourselves organized. There's an obvious link to patient safety, of course. So if you can't consistently access a patient's file, even within the same hospital, and then ask the confused, tired patient about the dose of morphine they're prescribed, you might as well not bother tagging on a convoluted process of checking and double-checking the dispensing process in the hospital pharmacy. The prescription is just unsafe. If you ask an elderly chemo patient whether they have 8 milligrams or 8 tablets of steroids, and then rely on a very hesitant answer, you're making medicine errors, very likely. But there is, I think, another really strong link, in my view. If culture is the stuff we do that we feel doesn't need explaining, then bad admin, bad IT, bad connectivity is actually cultural. A senior NHS England advisor told me recently of his wife's cancer and the dozens and dozens of appointments she had during its treatment. He said, at least a third of the time, when they turned up at the hospital, that was another one of those world-class ones, the appointment couldn't be found on the system, or his wife couldn't be found on the system, or the whole system couldn't be worked. A third. Each time, he hastened to add, staff were helpful and sorted it out for them. But I honestly cannot imagine having to work a process every day, all day, which doesn't work a third of the time. And I have to then find a bespoke solution to work around this problem each time. It sounds like a problem with culture to me. One where staff know there's no point raising this issue. There's no point suggesting improvements. Nothing will be done. Low expectations, low quality. Which for me leads to another massive impact of bad admin, staff morale. Because not only do bad IT and duplicated paperwork tell patients that their distress doesn't matter much in the greater scheme of things, They also tell staff that their time, their work satisfaction and sanity doesn't matter all that much either. Why else would you put people with a world-class education, a world-class reputation and world-class skills in front of a bad computer interface? Lumber them with a printer that doesn't work, deprive them of Wi-Fi. Staff are dealing with difficult stuff, hard conversations, distressed patients, angry carers, overload, time pressure. They need to feel that the processes they're working through are helping them to do this difficult job we're asking them to do. So I think it's time we stop calling bad process just bad admin, because it's actually bad management and bad leadership. If you work the appointment system and you have no interest in ensuring that the consultant, whose time is a massive bottleneck anyway, has all the data in front of them to have a conversation with the patient that actually enables decision-making, then you're not engaging in bad admin, you're engaging in bad care. Badly managed and executed care for sick and distressed people and overloaded and pressurized staff. If you aren't able to organize a process that enables patients to alert staff to increasing pain or anxiety or complexity and to deploy a good holistic response, then you will find these patients turning up in your A&E, where you then have 4 hours to fix a problem you've failed to grasp for the last 4 weeks. Is it fanciful to hope that sustained investment in the NHS for the next 5 or 10 years might be an opportunity to embed good transactional systems in well-designed processes that value staff and patient time and enable good decision-making based on good data? Could our new Secretary of State's interest in snazzy IT be given a decidedly improvement-focused bend? Could we stop treating these processes as mindless, useless, pointless admin and see them as what they are, a central part of good, modern patient care? We need to talk about admin.